There are other contracts and vendor types that you might need related to your emergency management and other things. But these are the mandatory ones that are checked at survey. Hi everyone, this is Mariam Treystman from the Home Health Consultant, and today we're going to talk about required contracts that are checked for hospice agencies at survey. But first, if you like our content, please like, share, and subscribe. So let's talk about the contracts that are checked specifically for hospice agencies at your accreditation or renewal surveys. First and foremost, there's the DME, Durable Medical Equipment. Hospice patients are typically going to be a little more high level in terms of their needs and their care, especially as they progress in their decline. As their decline happens more and more, you're probably going to need medical equipment like wheelchairs, hospital beds, possibly oxygen, and things like that. A reliable DME partner is crucial, and it's also the law. DME organizations that you contract with must be CMS approved, meaning they also have to be Medicare certified. These contracts are going to be very important, and you really want to get actually not just one, but like as many as possible. But this is a minimum requirement for passing your survey. The next kind of contract is the Hospice Pharmacy. This is going to be a little bit different from your regular pharmacy. Hospice pharmacies will typically charge like a monthly per patient charge kind of thing, because with hospice, you're going to sometimes need like emergency medication delivery that has to happen within like hours or, whatever. Because of the different structure that hospice pharmacies have to operate under than regular pharmacies, you need a very specific kind of contract for them. Please make sure that you have a hospice pharmacy that can deliver medications to a dying patient for their comfort in their last moments of life. This will be checked at survey. The third kind of contract that is checked at survey is your skilled nursing facility. Skilled nursing facilities in hospice are used for a variety of different things. Technically, when a patient enrolls in hospice, they are saying no to treatments for every other kind of treatment. They're essentially saying, I'm not going to try to fix this problem as I believe and my doctor believes it is unfixable. And so when there are medical emergencies, they should not be going to hospitals and other facilities like that. Regardless of how Medicare perceives this as an ideal, the patient is still a person and their family is still their family. And when family members and caregivers see somebody struggling or having a health crisis, it's natural for them to want to hospitalize the patient, call 911, and things like that. Even if it's not the intention of Medicare on hospice to do this, even if it's explained to them in advance that they are technically giving up their ability to use actual rehabilitative services. And so the SNF's role in this is not in a rehabilitative capacity. It's to give the family respite when they need it and to be able to handle the possibly high intensity clinical care required for that patient for whatever number of days that respite is required. And of course, if the case becomes hard to handle at home, they could also go to the skilled nursing facility, but then we're talking about a straight up transfer out of in-home hospice to actually facility-based hospice, different things. So you will need a skilled nursing facility contract, and that skilled nursing facility must be Medicare certified. This is conditional. It's problematic if you don't have this or if they're not Medicare certified, and you will fail your survey. The last kind of contract is technically optional, not required, but a lot of people do have this kind of contract, so it's worth mentioning. This is the staffing agency contract that will have staff that you don't employ directly. We are based out of Los Angeles, and so in Los Angeles, it is very common to have staffing agencies because there are a lot of generally like home health and hospice agencies in the area. Because of this, there's a very large and strong vendor support system, and it's hard to find physical therapists, occupational therapists, speech therapists to directly work for your company because in Los Angeles, it might like 5 miles of driving could be an hour of driving, and people really want to stay in their localized areas. Because of that, they tend to work with a lot of companies or will work with a staffing company that does work with a lot of agencies so that they can remain localized. That might not be the case in other places where you might have, let's say, one home health or one hospice agency for a whole county. At that point, you probably don't have staffing agency contracts being as prominent, and you're probably employing staff directly. Either way, whether it's a contractor or a staffing agency that then, hires their own clinicians, they will be looking at these therapies. Usually, staffing agencies will do therapy services, so they'll be looking at this contract if you have it. Especially in hospice where PT, OT, and to a lesser degree ST are not used that often. We do see ST kind of more prominent in hospice than in home health, and definitely then PT and OT is. So because you're not really going to be using physical therapy and occupational therapy and possibly speech therapy that much, since the patient is in decline and these therapy services are generally for rehabilitation, a lot of agencies choose to use them through a staffing agency versus direct hires because, as you know, if you hire a clinician but then don't talk to them for 3 years, like, are they really working for you? So in that sense, if you are using a staffing agency, they will want to see those contracts as well. So these are the mandatory contracts for hospice agencies for surveys. There are other contracts and vendor types that you might need related to your emergency management and other things. But these are the mandatory ones that are checked at survey, and in California, that are actually checked at licensure as well. So please make sure you have them to have a successful survey. Please make sure the DME and SNF are definitely Medicare certified. Usually that means that they'll have like a Joint Commission accreditation or something like that. And yeah, good luck with all of this. Again, my name is Mariam Treystman from the Home Health Consultant, and this was Mandatory Hospice Contracts for your survey. And if you like our content, please like, share, and subscribe. Thank you.